The promising statistics shows a positive step in the National Capital District's fight to eliminate TB, especially on a national scale. NCD contributes 35% of the country's total TB cases on average.
For every TB patients that come, especially adult or those who can cough, more older children, that much as possible they must produce a sputum, because TB is picked up in the actual sputum. When you see a living TB germ or bacilli, then you know that person has TB. Yeah, and so this very important initiative and support that is provided by these various partners in NCD.
The curable and success rates for the first quarter for 2018 are 71% and 70% respectively, and are measured against 2013 figures. Those conducting medical checks were advised to encourage TB patients to complete their dose, eat healthy meals, and refrain from smoking.
The other important outcome is what they call defaulter rate. Defaulters are people who fail to complete their treatment for whatever reasons. So way back 5 years ago, it was sitting about 30–40%. All right, and these are the people who actually contribute to drug-resistant TB. Drug-resistant TB arises from people who fail to complete it. And normally the TB is within the first, if you got TB of the lungs, within the first two months, you actually feel better very fast, as long as TB responds. And you think, oh, TB is gone. But in fact, TB is a very unique bacilli. It hides away. What they call, they are among the TB bacilli, there are groups that actually go and hide somewhere within the body. Okay, here we go.
Yes. At the launch of the new TB laboratory at the Badili Clinic today, development partners were acknowledged in the joint effort to fight TB. Badili becomes the second clinic in Moresby South to have lab facilities, and clinic manager Sister Tina Peter is grateful for the support.
That we have to check all the sputums for TB, and we didn't have a lab. We have to send our sputums to our patients. We collect the sputums here, keep them in the fridge, and then vehicle comes and take them to other clinics where they have lab. And then it takes time for the results to come back, and it was a very big problem. And our indicator, our problem with that is we never received results on time, and we had very bad report with that. So now that we are partnering with FHI 360 and NCD Health, Department of Health, was a very good initiative that we have come forward to put a lab here.
Tekla Gunga, National EMTV News.